board has taken a series of actions over the last 18 months. And one of the ones which I'll go into briefly as part of this presentation was to ask the Union County Improvement Authority to develop a request for proposal, analyze the proposals, and make a recommendation in a report to the board. What you're seeing tonight is that report. This is based on a process that began with the RFP in September, and there's been a series of presentations both to the board and to Runnells Hospital over the last couple of days. And so with that said, I'd like to just start it, and I'm going to go through this. We're not going to take questions while I'm going through it, but I know that the chairman will set ground rules after I'm done. So I'll go as quickly or as slow as I need to, but with that, Robert, go ahead. The first thing that we looked at was why we have arrived at where we are, similar to other counties over the past, over the last decade or more. And so with that, this overview provides some just details on where we are. In 2006, there was a change and a shift in dollars from long-term nursing care into community services, and in other words, trying to keep people in their homes longer. The county, through my department, Division on Aging, as a matter of fact, was the recipient of some additional dollars to do contracts into the community to allow and to help maintain people in their homes as opposed to sending them to nursing homes. That emphasis then continued in the state of New Jersey in 2007 when, with Governor Corzine at the time, they adopted the Independence, Dignity, and Choice in Long-Term Care Act. And it basically, that helped rebalance funding from what was going into long-term care at the time into community-based programs. And so counties then started to contract with various caregivers in the community to try to maintain seniors in their homes. And then long-term care became an option of last resort as opposed to one of the many choices that they had. With that, the impact of the policies was reduction in rates, which basically drive your reimbursements in a nursing home. The county subsidized Runnells basically to the tune of 75% of the patients or residents rather that come in are Medicaid. 25% are subacute, Medicare, and that is a mix that's fairly consistent in the state of New Jersey. It's about 80-20. This is 75-25. Last year, the finance department they detailed that the subsidy for Runnells Hospital at year end was approximately $13.5 million. And it's, as I've said in the last minute or so, that the reimbursements just do not cover the expenses, and the gap keeps getting wider and wider. There's four major trends that have impacted nursing homes. It's cost of health care and pensions continue to increase. Medicaid rates are decreasing, while the number of Medicaid eligible residents is increasing. Number of bed days decrease, and unlike in a private nursing home, that depend on a lot of per diems, and they can shift when the census goes down. In our nursing home, as well as in most counties, you rely on a lot of FTE, full-time equivalents, and you're not able to gear down when the census drops. So the overall census has declined, although Runnells has fluctuated, and the staff has done a wonderful job on bringing the census up over where it was the last couple of years, but it fluctuates, and it keeps fluctuating. And again, the emphasis on community-based services as an alternative to nursing home care has significantly affected the patient and fiscal operations. This will give you an indication over the last, from 1996 through 2013, which was at the end of last year. This is Camden. These are the counties that had to respond to that lack of reimbursement and the subsidy by having to sell their county-run nursing homes and hospitals. Okay. This then is the process that was used that you asked the Improvement Authority to go through. But before I get there, it really went back to 2012. If you recall, the board asked and commissioned a study. They commissioned a study to look at Runnells Hospital and make recommendations. And that was done in September of 2012. And they authorized the contract with Complete Health Resources Center, CRE, and that report was given to the board. And that basically they wanted to know and provide an analysis of the various options and or models available to reduce or eliminate county subsidization of Runnells Specialized Hospital. That report was given to the freeholders January 15th of 2013. After that report, the board then authorized on June of that same year, June 27th, they did an MOU with the Union County Improvement Authority, which essentially asked them, with a lot of other issues involved, but also basically to go through an RFP process and come back within 90 days with a report. So this actually started in 2012, and as a result of that MOU, on 9/25/2013, the Improvement Authority issued a request for proposal. There were information meetings and site visits held with those that responded to that RFP on three separate dates. There was a long question and answer period. In other words, after the proposals were received, they were reviewed, and there were questions, obviously, that came out of those reviews. And as a result of that, there was a proposal date. The first proposal date was on December 10th, 2013. The committee then looked at those proposals again. We asked for clarifications in January 6th, 7th, 8th, and 13th, which also, these were additional interviews with the proposers. We asked for additional information from them, and then we had another bidders meeting where they came to the table on February 14th, 18th, and 19th. And after that, they decided to issue a letter to all of the proposers that were still in the mix with what is your best and final offer. That was due on February 28th at 3 o'clock, and they were reviewed at 3 o'clock on February 28th, and they were looked and scored, and as a result of that, a draft report was ready, and it was given to the board in various subcommittee meetings, one for fiscal that had fiscal implications, one in policy that looked at the policy implications, and then tonight is 3/13, and this report now is going to the freeholders and also the general public. As I said a moment ago when I got into this report, what you see tonight is the exact same presentation that was given to the Runnells employees over the last 3 days, and what the board has seen previously in different committees. So there's absolutely no change. On this, these are anticipated actions if in fact action is taken tonight. They're tentative because if action isn't taken, if something happens, if you need more clarification, then those dates will obviously move. But we had to set some tentative targets relative to what the board wanted. And what you'll see is if in fact there is some action taken, we anticipate that there would be an execution of sale agreement in April. There would be trying to get the state approvals done sometime in the beginning of July, with perhaps a tentative financial closing in about the middle of July. Again, this is the report on the evaluation of the proposals. There are other decisions that have to be made before that and along with that as we go forward. Throughout the process, the county set objectives and parameters that they wanted to see in the request for proposal, as well as when the proposers came back with their various proposals during the last 2 or 3 months. Number one was would it reduce county subsidy on the facility from where it is now at about $13.5 million a year. They wanted to make sure that regardless of what happened, that there would be an assurance that the high-quality services that presently are delivered by Runnells and by county employees at Runnells for the residents will still be there, and that current Runnells patients would not be affected by any action that the board took. In other words, any action, if it's to sell, whatever that may be, that no resident would be displaced as a result of that action taken. Provide fair reemployment opportunities for all current employees in good standing, assuring that the Union County residents are given first right of refusal. What that means is, in essence, that if a new owner comes in, that all county employees or all employees at the hospital would be given the first right to refuse a job, providing they were in good standing. And that's a discussion between their supervisors and the new owner. Seek to obtain a fair and reasonable sales price for the facility. Seek to obtain economic value for future revenue growth. I'll get to that in a minute. It's covered in another slide. And minimize post-sale exposure risk to the county. These were the objectives that they wanted, and these are the objectives that were guiding principles as the review took place. These are the respondents that came in. You'll see 5. They are not in ranking order. They were just listed. CarePoint was actually thrown out within about a week or so, week and a half, because there were material flaws in their proposal. They did not meet the requirements of it. They were issued a letter, so they were out. Now we had 4. These are the 4. Just wait a minute. Everybody wants to look at it. If there are questions, obviously we can flip back to any slide later on. So, but I'll give you as long a look as you can at this point. Those are the semifinalists, and what you see here is a little bit of information on each one of them. Again, they're in no ranking order. They're just randomly put up there. And basically, it's who the principals are, how many years they're in business, how many nursing homes they own. This is nursing home beds. If they have any psych behavioral health, total psych beds, and what's the largest facility they manage. One of the criteria that was used to determine, as they submitted, like how they rate and how they do, was it's called the star rating, and you get that. It's Nursing Home Compare. It's on a website. Anyone can go in there and look at it. You type in a nursing home, and you'll see the latest surveys, inspections, and whatnot. This is used pretty much by everyone as an indicator of how well people do, although there are inherent flaws in just looking at that as the only reason to use a nursing home or not. There are things like someone may have just taken over a nursing home, and they inherit, if it was a bad survey, they inherit that bad survey, and it takes an average of 3 years to prove it. So there are different things in there. It's apples and apples and apples and oranges. But it's one of the things that everyone looks at. It's the first thing that someone will say, well, how do they compare? So you use that as a base indicator of how people are doing. But again, it is not the end all. There's other factors that are involved. What this does is each of those 4 finalists, semifinalists rather, this is star ratings taken off that website in terms of how they fared. And again, as I mentioned a moment ago, that some of these, they have asterisks, as you'll see. Some of them inherited deficient facilities, and so they have to work to improve those going along. I'll just give you a minute to go through it. What? I think you did. This is the third one, I believe. what it was for. One of the things, sure. Let's go back to that. Okay. There are things included in this presentation because the proposers asked for it. We wanted to be able to provide that information, so we included some of those things in there. What this represents is the total complement of staff at Runnells at this point, and it adds up to 396. This does not include those employees that went to Sodexo approximately 2 years ago when we did dietary and housekeeping. But this is current as about a week ago when we put it together, and it's just broken out by categories because it's one of the things that the proposers asked of us. Let me say that as part of the review process, and as we reviewed, there were questions that came back from the proposers. And during the course of that, we actually issued 14 addenda to that original proposal. All those questions and answers went on the website, and went to every one of the proposers. So every time they asked questions, we answered them and sent it back out again. So that was 15 times rather that we ended up putting an addendum to the proposal that we initially submitted or solicited. One of the things, the reason why this is in here is because when we looked at the proposals, people made certain assumptions, like costs would be reduced because a lot of people would retire. And in this particular slide, you'll see that may not have been the right assumption because out of the universe of 396, in terms of eligibility for 2014, only 52 people even meet the requirement. So we needed to show that if you're going to say there's a lot of savings and you're going to assume there's a lot of people that are eligible, that may not be the case, and it was not the case. As I mentioned earlier in a previous slide, on February 28th, all of the 4 finalists, semifinalists at that point, were asked to submit their final best offer. And we also, at that point, had certain things we wanted, in addition to what we asked for originally, that they had to respond to. And what you see here was not in the original RFP, but when the letters went out asking for the best offer, we asked them to provide us with this information in addition. And what this is the final cash purchase price offer. In other words, what is their final offer for the hospital? We wanted to know if they were successful, what was their capital improvement plan for 5 years? We wanted to know what they were going to do with that facility. How would they improve it? How would they change it? As I mentioned earlier on a previous slide, we mentioned revenue sharing. In one particular proposal, we looked at a couple things that they said, and then we asked the question, okay, you're buying this facility now, but maybe you want to create an adult daycare center, something like that. That's an additional service that doesn't exist. We want to share, or would you we wanted to share in that revenue that you now created for yourself, and what would be the answer to that question? Employment opportunities at other facilities. All of these facilities have other nursing homes. So in the event that people that are at Runnells now were not hired for whatever that reason may be, would they move them or be able to put them in other positions in other facilities? So we wanted an answer, a yes or no answer to that question. We wanted to know what the employee headcount would be at a closing. So in other words, we know today that the Runnells operates with approximately 396 employees, but we wanted to know how they were going to operate if in fact they won the bid and they were going to be the new owners. Obviously, we wanted to know that the reason is what would be the effect on the employees. We wanted to know whether or not they could achieve a closing sometime in July of this year. We wanted to know what their transition plan is, and we wanted to know whether or not they were able to give a 5% good faith deposit, non-refundable. This is a chart that answers those questions. So you'll see from the 4 semifinalists, offer jobs to employees at Runnells, everyone said yes. Offer jobs at other facilities, everyone said yes. Transition plan, yes. Due diligence, would they be able to close in 60 days if we got to that point? Everyone said 60 days. Were they qualified? This is based on evaluation, yes. Financial capacity, you'll see, and at some point, if there's a question, we have somebody else here that can answer the financial capacity and what that means. Quality of care, and number of facilities. So this was in addition to what we originally asked for. This is what they came back with in addition to that. That was the final, last best offer. And again, that was received on February 28th, opened at 3 p.m., and we did the evaluation that very day to go through everything that we had received. What is your way to tell me? Yeah, Robert. The other things that you'll see now is we were asked, or we were all asked to see what the impact would be on the budget going forward. So what we did is we used the appraised value of the property. And so one of the things that the board wanted obviously was to say, you need to do an appraisal, you need to see what the property is worth. The appraisal came back, the property came back at $26 million.
Excuse me, Director, just a clarification. Not the property, but the property operated as a nursing home?
As a nursing home, right.
Just wanted to make sure.
Yep. Thank you, Mr. Chairman. So it was $26 million. So we took that was taken, and then all of those costs that we are going to bear as a result of closing that we needed to cover were inputted in. And there are things like, as I mentioned earlier, if you remember, the finance department looked at it. It was a $13.5 million at the end of 2013 was the subsidy. The appraised value was $26 million, which you see on this side. And then there was, over the next 5 budget years, post-sale, the county would save over $56 million. That's at the bottom here. And putting the property back on the tax rolls, because obviously if it's bought by an owner, a private owner, it goes back on the tax rolls. Estimated $500,000 in new property taxes to the town and to the county. There are costs that we need to cover as a result of selling, and those things are, we have to cover unemployment benefits. This is an estimate based on experience. As an example, with Sodexo, approximately 1/3 of the people went on unemployment at the time, so we use that same, again, it's not an exact science, but you have to project something, and that cost is here. Loss of reimbursement, indirect expenses, you have $703,000. Cost of paying for the Union County psych patients. We still have an obligation, if the psych unit is not ours, to pay for those patients that are Union County. Pay off of the county debt. There is still some outstanding debt. That's roughly around $6 million, which is a conservative estimate. And that's important because as that figure holds and gets drilled down a little bit more, that comes off immediately off the sale. You have to pay off the debt first. Cost of paying pension, there's a pension obligation for employees. So that's that figure, but that all comes out to that side, and that's the net benefit. The next slide basically runs this out for 5 years. So it's essentially what you saw previously, but now it's a 5-year breakdown. And if you add these figures up across, then they will add up to the net figure on the previous slide. So you'll see that there are costs that need to be covered this year. Some of them go away because the obligation ends. And at the end of 2018, you're looking at about a $10,738,000 benefit or savings to the county as a result of this. Last slide. Recommendations, part of the evaluation process. Whatever the board does, if they proceed, whatever the decision is, if they proceed to go forward, recommend to proceed to contract with the highest ranked proposer. They have to begin a transition plan, seek state approval and make every best effort to close somewhere in July of 2014. And that, Mr. Chairman, ends the report from the committee.